go through tomorrow. We've had a lot of questions and feel we've done real good with it. First, I'd like to say that I want to say thanks for the partnerships that we've had since 12 March. Heather and I have been attached at the hip working this, and the same as our partners with BCC and the Sheriff's Office have been working together in this county-wide. And we really value those partnerships, and I think that's what's made us successful here in the county. So thank you to all our partners that's assisted with this. As we stated, tomorrow morning at 9 o'clock is our first appointment that will begin. We've received 3,000 doses last week. We opened up on Tuesday and Wednesday for a soft opening. We did some healthcare professionals and then some of our independent living folks just to kind of run through and test the process. And then we also opened up the appointment site. Our site is appointment only. If you do not have an appointment, you will not be allowed on the site. You will be turned away. We're asking folks that to show up about 15 minutes before your appointment, then you can get in, get the paperwork done, that type thing. There's no need to show up, an hour or 2 hours beforehand on this. We are currently booked. All our allocations are booked through 20 January. At this time, we're supposed to be getting some more this week, and as soon as we get more in the county, we will open it up for those additional days. We are not doing a reservation system or a lottery or anything like that. As we get the vaccine in theater, we will open up the additional days for what we've got. We do about 200 doses a day, so as we get more in, we can open up additional days for that. And again, that booking site is always going to be at alert.claycountygov.com. And this week, by Tuesday or Wednesday, we should have the second dose sign up. We're getting ready to launch the second dose sign up, and that will also be at alert.claycountygov.com, and it will be scheduled my second dose for that. So I do want to say that as we move forward, there's going to be limited supplies coming into the county. We're hoping here soon, within the next month or so, that our private sectors start coming online. Publix, Walmart, CVS, Walgreens, those type things, so there'll be more distribution points throughout the county. Right now, we're going to stick with the limited allocations we have coming in. We're going to stick with the Godbold building at the Ag Center, and that site will open at 8:45 tomorrow. It's currently coned off, that type thing, and we will open that up at 8:45 for our first appointments to come in. So I'm going to take this time, and I'm going to turn it over to Ms. Heather Huffman with the Department of Health.
Thank you, John. Again, we are following the governor's executive order for prioritization of the vaccinations, and we want to make sure that we're following that very closely to make sure that we're being equitable, not only in Clay County, but also in the other counties that surround us. So John is correct. We received on 12/28 last Monday 3,000 doses of the Moderna vaccine, which is a 2-dose vaccination for COVID-19 that are 28 days apart. At that time, we began vaccinating health department staff that would be working the vaccination pods along with paramedics. We did a couple of soft opening launches so that we were able to get in some of those independent living facilities to be able to work out our processes before we went to full capacity on Monday the 4th. Again, we are still continuing to work that executive order. The priority groups, again, continue to be healthcare workers with direct patient care and those 65 and older. When individuals come on 1-4, we want to make sure they bring their ID with them. That helps the process go a little bit faster. And as John said, we're doing 200 appointments a day for about 1,000 shots a week. There's been a lot of questions about the second dose and where that comes into play. Our second dose, based on when we started on 12/28, second doses for individuals will begin on January the 25th. We have built capacity within our system that once we move into that week and the beyond weeks, our capacity will move from 200 a day to 400 a day, and that will allow for half of the doses to be based on first-time shots, and the half of the doses will be based on second-time doses. Again, appointments for all of this with the great partnership we have with Clay County BOCC and Clay County Emergency Management. All of those appointments, when we have the additional vaccine dosages in the county, will be at alert.claycountygov.com. Again, we are asking for patience from the community as we have limited quantities, and we want to continue messaging those mitigation strategies: social distancing, wearing your mask, staying away from others, large gatherings, washing your hands. Those are always going to be very important. So again, as we get additional vaccines each week, we will add additional days based on the number of doses that we have. So continue to check back at alert.claycountygov.com, and we will also be using our social media feeds in order to provide that information out. The good thing is that we do know that there will be other access points that will probably come online in the next few weeks. Those will be your retail pharmacy partners, such as your CVS, Walgreens, your Publix, Walmart, all of those places that you would normally get your flu shot. Those will come online, along with all of your healthcare providers that have signed up to be a COVID-19 vaccine provider. So there will be more availability of access points within our community. As you know, the state of Florida with the federal pharmacy program is in that partnership to vaccinate all of those in our long-term care facilities, which include nursing homes and ALFs. So those residents and those staff that work in those facilities are already being vaccinated with the hopes of all of them being completed in the months of January and February for first dose and second dose. So at this time, I'm going to turn it over to Sheriff Cook, who we're going to go over a little bit about the operations at the actual site.
Thank you, and good afternoon, Clay County. First, I want to give a shout out to the Clay County Health Department Director, Heather Huffman, and Emergency Manager, John Ward. You know, anytime you have something this big going on in your county, you know, you need to have a solid plan and a planning process, and these two have done a fantastic job of putting a solid plan together, and we are very happy to support that plan. So tomorrow morning, we do not expect to see any traffic issues. If you come, as John said, just 15 minutes before your appointment, you should be able to get right in. The Clay County Sheriff's Office has set up variable message boards, and we'll have traffic deputies along Highway 16 and deputies on site at the Godbold building where the shots are being given. Again, we don't expect any issues. We ask that people just come 15 minutes before their appointment time. There's no need to line up early. We're going to make sure that everybody gets in safely and efficiently, and we don't expect any issues, but we do have deputies assigned to be in the area in case anything comes up. Again, I want to thank the citizens of Clay County for their patience and their spirit during this trying time and putting forth those folks in our community who need this shot the most, and that's our over 65 and our healthcare workers. And again, just on behalf of the men and women of the Clay County Sheriff's Office, I'm proud to support this plan and look forward to a smooth operation. Thank you.
Talk to you a little bit about what to bring with you when you come to a pet-friendly shelter. It's a very stressful environment, so we want to again make sure that this is our last